Thanks for joining us. This is Sarah Jones with Politicus Radio, coming to you live the day Republican senators finally unveiled parts of their secret health care bill, first to lobbyists and reporters, and then finally to some of their own colleagues. To sum it up, it seems, the hot take on it thus far, because no one has really had, a chance to examine everything, is that poor people will pay more for worse insurance. The Republican Senate death care bill does not pass the Jimmy Kimmel test. Joining me to talk about the 3 reasons why the Republican health care bill is pure evil, his words, is PoliticusUSA's editor-in-chief, Jason Easley.
Hi, Sarah. Thank you for having me.
So, this is already one of the most unpopular things possibly ever unveiled. A new Huffington Post YouGov poll, just 5% of Americans strongly favor, quote, Trump care. I don't know what they're calling it now. I'm calling it death care, and I think it looks about right. Even the Republicans don't like the AHCA. 5% are strongly in favor of it, of Americans. 24% in all favor it. That's even less than approve of Donald Trump.
Yeah, that's a pretty low bar. When you can't clear more popular than Donald Trump. This, I agree with you, might be the worst, least popular piece of major legislation ever unveiled. The Democrats just have to sit back and sort of say, this is what this does. And people go, oh my God. It takes away everything. Like we talked about yesterday, this isn't just a repeal of Obamacare. This is a repeal of health care, period.
And an attack on Medicaid.
It goes further than just repealing Obamacare, but it will not just raise insurance costs on the poor. It's going to raise insurance costs on everyone.
That's a really good point. I mean, I think one of the things, there's so many things to talk about here that are just astounding. One of the things that's really kind of frightening is the way they have all these kind of little time bombs stuck in here. This will deploy after 2018, so after all of you vote.
Yeah.
You'll find out how you will think, oh, maybe it's okay, I didn't get screwed that badly. And then after everyone votes in 2018, X, Y, and Z is deployed. Then they have a bunch of other stuff that's not going to be deployed till 2020. I mean, they couldn't really be more obvious about it if they tried.
Yeah, I mean, by staggering it, you're right. They're just trying to hope that they can do this right now. People forget about it and gradually begin to accept the fact that they're going to pay more for less health care. And that's what it comes down to. If you have health care, it's not going to cover as much. By definition within the law, the total cost is going to go from 70% mandated coverage, has to cover 70% of your cost at least minimum, to 58%.
58, yeah.
So by law, it's going to get more expensive and it's going to cover less. That's not a talking point. That is what the law says it's going to do. And when you get rid of the mandatory coverage, the 10 mandatory care areas, and you gut them and throw them away, and you allow people to pay, they're saying older people, depending on what state they live in, could pay 3 to 5 times as much as other people.
Oh my God.
I mean, it's beyond. There's no redeeming value to this law unless you're a billionaire. And then you get a big tax cut. Because every Republican piece of legislation seems to end with, like, a bad fairy tale, and then the billionaire got a big tax cut.
Right. Some of the tricky things that I was referring to, just to throw these in here, are so far. I mean, again, this hasn't been, the CBO hasn't even scored this yet. And when Democrats were undertaking health care, of course, this went on 270 hours of debate. I mean, and they accepted so many amendments from Republicans. So what we're seeing right now, and trying to have a dialogue about this even, is very difficult to be comprehensive. Nobody has even really had a chance to think about and to work things through what happens with X, Y, and Z. And you have this in here, and here's 2 examples. The Senate bill scales back premium subsidies, so if they end up costing more than 0.4% of GDP, the Senate bill cost-sharing subsidies only funds that through 2019, and then it eliminates them beginning in 2020, which means higher deductibles. People won't see that coming into play until years later. Now, Obamacare also, of course, was phased in slowly, so people might say, well, that's just what you've got to do with the big piece of legislation, and there's a lot of truth to that. But some of this stuff is very political. It's stuff that is going to impact, middle class voters, working class voters, and obviously poor people. They're going to get impacted right away. So a lot of this other stuff is kind of tucked in here to deploy later. And if I know Republicans, like I've come to know them, they'll find a way to blame other people when that stuff happens.
Yeah, one of the most insidious parts of this legislation is something that happens within Medicaid. What will happen within Medicaid is they will drop for children, the elderly, and disabled people. They will drop the mandatory coverage minimums in Medicaid. So Medicaid won't necessarily have to cover you if you have cancer, if you have diabetes, if you have heart disease.
I'd like to go back. A lot of times, it seems, when we're talking about Republicans, we have to go back to the basic definitions of things. What are you buying when you buy insurance? If you buy insurance and you're not even buying catastrophic insurance, your Medicaid, whatever you have, and okay, your people aren't buying that, but it's called insurance. What is that for if it's not going to insure you when you need it? Insurance isn't something you need when you don't have an illness. When a lot of us can manage to go to the doctor if we have we need to go to the doctor for the flu or something. That's not what this is really all about. It's to keep people from being unable to afford life-saving health care. That's the bottom line. I mean, if you really want to get down and dirty, I don't know why we were reduced to discussing this in such pure terms, but since they want to take these things away, this is the way that it has to be discussed. That it should be covering much more is my point, and I hate to just...
Oh, exactly. I mean, you're talking about the sort of coverage, like you said, that won't even cover a major illness.
I do want to tell our listeners just quickly, sorry to interrupt you, we have a flash flood warning here, so you're going to hear stuff in the background. It isn't rage at Republicans, it's not, but it might sound like that.
It's not the floodwaters coming to our door, it's
not
thunder.
The end times or Noah's Ark, it's just... a
little bit of severe weather in the neighborhood.
A little bit of severe weather. The weather is not happy with this bill.
Yes, even the weather hates Trump carrier.
It's just so sad. I mean, I watched a video of this girl who voted for Republican. She voted for Senator Cassidy in Louisiana, a Republican, and he promised her, she spoke to him before she voted for him, and he promised her that he would not vote for a bill that would mean that her daughter, who has leukemia, wouldn't be able to get care. And she said in this video that this is exactly what's going to happen with this bill, and why would he vote for this when he promised her? I mean, it's just heartbreaking to think. I know people should educate themselves before they vote, and I don't understand why anyone would vote for a Republican if they cared about health care. That's really doesn't make sense right now. I'm not talking about the Republican Party as a whole, but in the last decade, let's say, this is not a smart move. If you need health care, you shouldn't be voting for a Republican.
Yeah, if you have a sick child, these aren't your friends.
Yeah, that's the bottom line. I mean, this poor woman, she's just heartbroken, and there's got to be a way to get through to people so they understand what they're voting for, but Republicans they're sabotaging Obamacare right now, so this is how they do it. And then they start saying, "Oh, so and so dropped this insurer doesn't want to be a part anymore because Obamacare isn't working." Do you see them going back to Obamacare to tweak it to try to help it work better? No,
because that's not the end game. The end game is to make it so broken that they can replace it with whatever they think they can replace it, and people will be happy. Like, no one's going to remember the kind of health care they had the year before. Like, no one's going to remember how their medication used to be covered and now it's not.
Well, I remember my union insurance, so let me just share that, because that's a complete fallacy. If they believe that people aren't going to remember, I remember my union insurance. It covered everything. I never had to pay a deductible. I didn't have to pay co-pays, and we had hospitals dedicated to people in the film industry. You just go there, they take care of everything, and you're done.
Yeah, I mean,
none of this.
This legislation is diabolical in a lot of ways, but the way it targets people that are already sick, the way that it targets older people, the way that it targets more vulnerable people, are three of the most evil elements of this bill. I mean, and the way it's going to raise everyone's premiums. It doesn't matter if you get your insurance at work. It doesn't matter if you buy your own insurance. It doesn't matter if you own your own business.
All those
everyone was like, well, Obamacare, I didn't get a subsidy, and so Obamacare sucks and I hate it. Well, guess what? Now you're going to have less health care than you have before because Obamacare was more than an exchange, as we talked about yesterday.
People screeching about Republicans? I specifically remember Ted Cruz's. I don't remember. She did both things. She's on CNN now, but Amanda Carpenter. But she did his speeches and communications basically, and she was always tweeting that I had to change my doctors, and I kept trying to tell her, like, do you have any idea how entitled you sound right now? I mean, it is not the worst thing in the world to change your doctor, and it's not the worst thing in the world to have a glitch in a website. Now here we are. There's no way to even make a comparison between those complaints, which they elevated with such a cacophony of screeching hysteria over the last, since 2009. So they managed to do that. They never stopped. And that's something Democrats really need to learn how to do, because you see, even the Democratic base, the Democrats that are in office and the base both kind of suffer from something that is positive, is a valuing civility and valuing facts, but
the intellectualization of everything.
Right. When you get down, when you intellectualize everything so that you distance yourself from the emotion and from the visceral, like, this is actually happening to real people, you lose that in your message when you're getting too lost in the weeds talking about this stuff. And it's something that Democrats suffer from, and the base doesn't keep on. They're not relentless. Like, you look at the right, they never stop.
No.
I don't care what they lose, how they get slapped by reality. They are relentless. They are there. They are online everywhere. They're in real life. Every time you talk, ask anyone, everyone has one in their family who won't shut up. Everyone, I bet you, gets emails from people in their family and friends, or from a coworker, or from someone you met once at a party who won't stop sending you those stupid, false Republican talking points. You don't see the left doing that, and maybe it's time that the left not become trolls and not buy into false narratives, but amp up the messaging a little bit.
Be persistent.
Be persistent. Don't give up, but don't stop. I mean,
and the problem that I think. Excuse me. I'm going to interrupt you. I'm sorry.
Go ahead, man.
The problem that some Democrats are having is they're trying to intellectualize in an emotional environment. So all this hand wringing about why are Democrats losing, why are Democrats out of step, it's easy. Because this is an emotional partisan landscape that still some are trying to intellectualize it. No one cares about your stupid facts. I love facts. You love facts. I love data. You love data.
But you can take your facts and make a message out of your facts.
Make an emotional appeal.
You don't have to be false. I mean, you should never be false. You don't have to be false to make a message.
Make an emotional appeal based on fact. The fact itself is not enough. Your fact of, well, that's not true because 27%, no one cares.
Right. You see that all the time. and then there's these long, like, okay, let's get into this, and let's get into all the nuance. But the problem is, in this environment, the nuance is completely lost. So when you try to compare things, again, I'm trying to... You see the media is doing this. They're conflating what Democrats did when they passed health care with what Republicans are doing as if they're the same thing. Why?
Yeah.
Because Republicans screamed so loudly when Democrats actually did not shut them out of the process, that what is remembered is that Democrats shut them out of the process, when this is actually completely 100% not true. Did they decide not to vote for it? Yes, that was their own decision. And for that, making that decision, which what they would call obstructing, by the way, in which they call that now, and it is. I mean, you can look at it either way. That's fine. That's what they chose to do. That isn't how they presented it in the media. They presented it as Democrats wouldn't let us participate, even though the facts were that Democrats took on their amendments, although their amendments, for the most part, weren't anything meant to help, and a lot of times they were sort of technical things. But they were given an opportunity. They chose not to participate.